You said.
Yeah. So we're gonna get started today with grief and loss, and then we're gonna do our mental health review afterwards. Mental health review is not gonna be recorded, so if you're here, good for you, you get to get the live in-person version. But I am not gonna record the mental health review. But there is a game with practice questions everyone can do on your own time, and the PowerPoint for the review is also okay. But of course, we're gonna start with our grief and loss first before we get into mental health review. So grief and loss, it's pretty straightforward for the most part. All of this comes out of your mental health book. Okay, there's a whole chapter on that. And that's listed also in your study guide for grief and loss. But basically, we're gonna go through all the stages of grief and loss, and that's where a lot of the studying comes into play. But we have to start first with what is the human experience of our loss. So how do we interpret loss as human beings? Okay. Loss is something everyone's gonna deal with, right? My mom always told me I'm one of those people who has death anxiety, right? Some people have that. My mom always told me everyone who's born is one day going to pass away, right? It's a part of the process of life. Okay. The reason I'm doing your lecture today is because I worked for quite a while in hospice and oncology, so we talked a lot about grief, loss, and the stages of death and dying. Okay. But a lot of loss involves letting go. Okay, it says moving on in your book, but it's very hard. How do you move on from a loss? Right, it's very difficult to do that a lot of the time. But also, loss comes with certain areas of growth and development for a person. Right? So some people learn a lot about themselves through the process of loss. Okay. There are a lot of different types of loss. So think about the differences between expected loss or unexpected loss. Okay. So loss is a lot different if someone is in hospice for a long time before they pass versus someone who gets in a car accident and the loss is very unexpected. Okay. Sometimes they have loss in your book as can be beneficial, okay, but also it's more often devastating. Okay. So there are other types of loss. Think about things like losing childhood dreams or aspirations, losing toys, okay? So it's not just about death and dying, but also some of those personal things that we hold dear. COVID-19, it was a huge time for the grieving process and death and dying as well. So a lot has changed since the pandemic. Okay, so we need to understand the differences between our grief and bereavement. So grief is your normal emotional response to your loss. So that could include losing your toys and things like that. Okay, grieving bereavement is the process of loss. This is why we call, time off from work or school bereavement if you lose someone who's close to you. Okay, so that's the process that we go through. And that includes that wide range of your thoughts, your feelings, your actions, okay? There's also things like on the slide, anticipatory grief, okay? So if you know someone's going to pass, okay, you can start to grieve before they're even gone, right? That happens a lot in hospice care, when patients are at the end of life. You can start that grieving process pretty early in that case. Whereas if it's an unexpected loss, you might not start grieving until that person is actually gone. Okay. What else was I going to tell you? Mourning, remember that's that outward expression of your grief, so you can tell if someone's in mourning. What do we do at funerals to express our being in mourning?
You wear black.
You wear black, right? So that's kind of how we can express that mourning with our clothes and things like that. There's also differences in funerals. Some people have wakes. Okay, my grandma, she's now passed, but she always said before she died, she had cancer and then she went into remission, but she ended up passing kind of unexpectedly. But she always said, when I die, I don't want a funeral, I want a hoot nanny, okay, because she was from the South. But she'd always say, I just want everyone to come together and have a party because to remember me, okay? So there's lots of different ways that you can express loss and mourning and things like that, okay? Pandemic. So think about this. Did anyone have anyone close to them passed during the pandemic or know of anyone who might have lost someone close to them, think about the impact in your mourning rituals, right? Could we have the same types of funerals we had beforehand, right? They probably had to have social distancing and things like that that impacted that mourning process. So as nurses, how can we support grieving? Okay, so we have to first understand what patients are going through. Some of us in this room may have not really experienced grief or loss yet in our life. Others of us, we are tried and true and we've went through it, okay? But no matter what, we have to kind of go back to a place in ourselves where we can understand that loss, okay? And understanding that the cultural response is gonna vary. Okay, I had a patient on hospice and it was unexpected loss. She actually got hit by a car, okay? And she was on hospice and they decided to discontinue life support, but she was Amish. So that was very different culturally to care for her because everything I did, she had a husband, but we had to kind of go through the father, right? Because the father is the sole caregiver in the Amish community a lot of times. So the way they went through grief was much different than I was used to, right? They didn't show emotion as much, right? They were kind of closed off to that grief, but I'm telling you what, all members of that family ended up rotating in and out to say their goodbyes, okay? Whereas other cultures, you may not see those extended family members, they're going to go to more of those funeral and things like that instead of coming to the hospital. So it very much differs depending on the culture. Grief is going to be kind of your primary focus of your treatment. So treating some of those feelings of grief and those coping strategies that we talked about during mental health, right? So think about your positive coping mechanisms. What are some positive coping things we can do? What are positive things we can do to help?
Breathing exercises.
Exercise. Breathing exercises, exercising, sharing memories, right? There's all kinds of different things you can do. Sometimes the funeral process itself can be a way to cope with that loss, okay? Also, there are going to be negative ways people cope, right? Think about things like alcohol use, okay? Do we consider that positive? No, right? Drug use. Some people are going to struggle with that as they go through the stages of loss. Also being aware as a nurse, right? If you see something or you see a loss that kind of hits close to home, are you going to be able to care for that patient effectively, right? If you are, and this happened to me a lot in hospice at the beginning, I would just kind of sit at the nurse's station in my back little corner and I would just sit there and cry. Am I being useful to that family at that point? Not really, right? But is it okay to cry with your family? The family. Occasionally it can be, right? But we don't want to distract from their own trauma or their own loss with some of our own problems. But sometimes families would say, you know, I can tell that you really cared as well, and that makes them feel good too. Okay, but again, if you take anything from this slide, teaching those coping skills and understanding what those are. And of course, providing empathy. So you may never understand how they feel, but trying to put yourself in their shoes when they're having a loss. Okay. The biggest one we see most often for the stages of grieving is going to be your Kubler-Ross, okay? So I'm sure everyone's heard of this before, right? We start usually in the stage of denial, okay? So your significant other gets hit by a car. No, that wasn't them, okay? That's that feeling of denial, okay? My husband came in one time and my dog got hit by a car, not this past summer, but the summer before. And I was like, that wasn't our dog. I just put him outside in the backyard. We have a fenced in backyard. Oh no, it wasn't my dog. He had climbed under the fence, got hit by the car. So then I went straight into, not anger, I skipped a few steps, but I went into, you know, that bargaining, like, how did this happen? It wasn't because and then I had a lot of blame for myself. So sometimes you can have that blame and that guilt because I was like, I let him outside, right? So it's my fault. But usually it's going to follow in the stages. So you start with denial, okay, leading to anger, okay? That can be towards self and others. So yes, I was a little bit angry at myself, right? Because I was like, man, I let him outside. I probably should have checked the fence a little bit better, but I never had any problems. Bargaining, asking for more time with that person, so pleading to God, pleading to whatever entity you might believe in for more time. Depression stage, okay, that can last any amount of time too. You can be in these stages, depends on the person, for any amount of time. And then acceptance. Acceptance is the most difficult to get to. Okay, so accepting that loss has happened. Do you think every person, by the time someone's funeral comes around, has dealt with all of these stages of grief? No. They could definitely just be on the first stage and be there for quite a while. Okay, so we have to definitely, as nurses, give them that time to kind of come to terms with that loss. Okay, but understanding the stages does help providers in how we care for our patients. Okay, and things like that. Right. There's another one in your book, it's Bowlby's Phases of Grieving. Okay, so you might have also heard of this one. Starting with things like numbness, okay, that also falls into denial a little bit. So you're not necessarily feeling that loss yet, right? This happens a lot too. If you get a phone call, right, that someone has passed, you might not feel that direct hit of the loss yet. I lost my cousin a couple of years ago, and my aunt called and she's like, yeah, my cousin's name is Courtney, she's dead. And I was like, right. And I didn't feel that until later on, right? And then it's very difficult to kind of cope with that. Whereas if you're there for someone's passing, such as hospice, or if they pass in like the hospital setting, you might feel that more immediately. Okay. Yearning is that emotional longing for that person, maybe protest to what's going on. Disorganization, issues with the cognitive. So not able to focus at school or work, right? Disorganized thoughts. Reorganization is that last step where you start to get that sense of self back, right? You can think back to good experiences you might have had with that person. Okay. And then you're able to kind of reorganize your thoughts a little bit. Okay. But any disruption in that bond causes those intense emotions. So this one kind of focuses more on the bond itself. Does that make sense? And the connection with your own emotions. Ingalls stages. So this one, and a lot of these are pretty similar, right? You usually start with like your shock, your disbelief, your denial. Okay. This one starts with shock and disbelief, then awareness of what's going on, and awareness can come with all those different emotions, right? Crying, anger, outbursts. And then restitution is participation in rituals, so your funerals, your wakes. Resolution, a lot of times this comes with preoccupation, loss. Okay, so just kind of obsessing over it a little bit, or just that's where your thoughts kind of gravitate for most of the day. And then recovering from that, so moving forward with your life. Okay. It's not on us to say how quickly someone should get over a process of loss. Okay. We don't decide that, we just have to help them through that. And one of the last ones here, these are all listed on table 10.1 in your book, but is Horowitz. So this one starts with outcry, that initial realization, okay, leading to your denial, right? So you're seeing a trend by now, right? And how you kind of process that. Working through those emotions. Completion is where your life goes back to normal. With this one, they talk a lot about anniversary dates, right? And how that can trigger feelings. My cousin I told you about, she passed away right on New Year's. So am I happy for the new year usually? No, it kind of reminds me that she's gone, right? I'm living another year, but one of my favorite people in the world that I had isn't living that with me anymore, right? And then memories becoming less painful over time. Okay. So as the years go on, you might go back in time and feel that loss a little more deeply at a certain time in your life than another. But usually you're going to be able to work through those feelings a little bit better. Okay. That's what we want to see in our patients. Okay. So tasks of grieving, in your book, they call this the Rando 6 R's. So recognize, okay? experience and understand that loss, reacting, so that's your emotional response. Recollection, so reviewing and reliving those memories with that person, or even your animals, right, if they pass. Relinquishing is letting go of that control, accepting kind of what has happened. Readjusting is adapting your life, right? If you lose a significant other, right, in an unexpected accident or something like that, your life is gonna change substantially, right? So think about that. If someone you rely on for a lot of things is gone, you're gonna have to change a lot about your life. Reinvesting is forming those new relationships and embracing change, okay? So if you lose someone close to you, you lose a friend, how are you going to then, if it's someone you go to confide in, who are you gonna go to, right? How are you going to adapt to that loss? And grieving does require a little bit of participation, right? So the patient, if they're not accepting of, the need to grieve, are they gonna recover from that loss very well? I think with grief, you have to work through it, or else you're gonna be stuck in those early stages of denial and anger, and you're never gonna get to that resolution, right? So we have to encourage them to work through those things. Dimension of grieving, so grieving does affect all of our holistic health, right? Our mind, our body, our spirit, okay? The holistic model involves the cognitive, emotional, spiritual, behavioral, and physiologic response, right? So it's not just your emotions, right? We can actually see that manifest physically, right? So patients may get that increase in heart rate and respirations, right, when they find out there's a loss. Okay. But again, it's very individualized, so everyone's gonna feel different. So common emotions we might see, again, anger, sadness, guilt, and anxiety. Okay. In hospice or anywhere else in the hospital, if you have a patient who passes, be careful with your family members. You might not know how they're going to react. Or you might think, oh, this family is going to react just fine to this loss. And all of a sudden your family members are throwing things, right? I've had to call security on family members because they don't know how to handle that loss. Okay, so as the healthcare provider and the nurse, you guys need to be very aware of your surroundings when you're disclosing losses. Okay, especially if you want to go into the ED. Okay, you have a patient who came in as a trauma, you need to have some backup when you tell that family that this patient is gone. Very important. Also, these, the loved ones who go on, they might feel some resentment towards themselves. Think about that. If they feel guilt, right? If they were driving the car and they live, but then someone else passes away, do you think they're going to feel some pretty extreme guilt, right? Or they may feel, that resentment or anger towards someone else, or even the deceased person. Okay. So there are people who are angry because someone passed, right? So keep that in mind as well. Normal reactions, anywhere from crying, screaming, all the way to laughing, okay? I've had family members start to laugh, and it feels very odd. I'm telling you that right now. If you haven't experienced it, it's just a way for them to process. Usually the laughing then turns to crying, right? But they don't know how to process those feelings, okay? And then they may still hope for a reunion with that loved one or that lost person. So they might say, it's okay, God's gonna, we're gonna see each other again in heaven someday, and you just have to kind of support them. Okay, those feelings. So thinking about that initial shock, you can have that irritability, bitterness, okay? But again, when they understand that death is final and it's permanent, that's when that depression starts to kick in, okay? So they start to think about their life going on and not having that person in their life anymore. But hopefully as time goes on, they're going to be able to cope with that. Do you think you're going to see many people in the later stages of grief? We're probably going to be more in crisis stages as nurses, right? When we're talking to families about the loss of a patient. Cognitive responses, you might hear a lot, why did this happen? Okay. Issues with life is not fair, okay? This person should not have been taken from me, okay? Trying to find meaning behind it, okay? So they, passed because this X, Y, Z, right? So they're trying to rationalize it a little bit. And then they may gain comfort through those spiritual reactions. So another thing is if you have an imminent loss in healthcare, it's always a good idea to have the chaplain nearby. And that's why the chaplains respond to your codes in the hospital, right? Just to be there in case the family, the loved ones need a spiritual support. Okay. And then making sure, that you have that nice dialogue between yourself and the family as well. Spiritual responses, we kind of talked a bit on this, but you may have patients who had a very close relationship with something spiritual and all of a sudden that relationship is kind of shredded, right? And behavioral health, I see this a lot. And a lot of our behavioral health patients are in there because they had, it might have been an anniversary of the loss of a loved one. Okay, and that causes some mental health issues. So then they come in to see us and they're like, yeah, I'm upset because, it's the anniversary of my daughter's death. Right, now I'm in this deep depression. I can't seem to get out. And then I had a patient tell me one time, I used to believe in God, but how does a God allow my baby to be taken from me? Right, so they struggle with that internal conflict. Nursing role, we have to attend to those spiritual needs. So maybe calling the chaplain, right? Allowing them to disclose those thoughts to us and then help them to find some meaning if we can. A lot of times that spiritual component will help them to process. Again, behavioral responses, you have your numbness. So remember when we talked about numbness, the outcry are those emotions that we display. Okay. Irritability and hostility happens a lot. Okay. And those fluctuating behaviors and maladaptive behaviors. So think about those negative coping mechanisms we talked about. Okay. It goes all the way to those extreme responses of self-harm, suicide, homicide. So these patients and these loved ones are at high risk for things like that. So we need to be checking for any thoughts of self-harm or suicide. So let's do some practice. Okay, so I'll let you read through this and then we'll talk about it in just a minute. So go ahead and read through the case study. This sounds like a pretty healthy way of grieving based on what you have. For the most part, yes, right? It's pretty good. Now, question number one, and everyone with it. A nurse is providing support to Mark, who is grieving the loss of a spouse. Which of the following statements indicates a healthy progression in the grieving process? What do you think? Shout it out. You got it? B, right? So focusing on hobbies and making new friends, right? What does that a sign of? Positive what? Hoping, right? Exactly. A, what does that sound like to you? Maybe some denial, right? Can't believe that's happening. What about C? Could also be a little bit of denial, right? Or just trying to push everything off, not feel those emotions. And then D, is anger a very good response? Is it healthy? No, it's part of the grieving process though. Okay. Good. So it is B. While assessing Mark, the nurse notes that Mark feels wired with electricity and is experiencing numbness during daily activities. What is the priority nursing intervention for Mark at this time? C, thank you, yes. Because remember, we can go through the whole grieving process and think we're okay, right? And then I said something could trigger us to go back in time and start to feel some bad feelings again. So he could be at risk for a safety or issue with self-harm. So we need to assess for that. Does everyone follow me there? Good. So cultural awareness, we need to make sure that we're, the best that we can following their cultural needs, okay? Because again, the mourning process does vary. Okay. Immigrants may lose a lot of their cultural mourning practices, okay, and that can make grieving more difficult. So we need to take that into consideration as well. Okay, there are some cultures, I think your book mentions, where typically they will burn the body within a certain amount of time, okay, as a cultural thing. Can they do that in the hospital? No, right? We need to go through some processes first. But in their culture, that's what they do. So it's hard to kind of adapt to that. Okay. Also recognizing those diverse grieving behaviors. So people of certain cultures may not display grieving as we do, right? So they may not cry, they may not show those emotions, but they're still grieving, right? And then encouraging the use of things like prayer or privacy as needed. So there were some patients in hospice and families, they wanted me to stay in there for a long time, right? They wanted me involved. Others, they were like, can you give us a little while? Okay, so we have to be respectful of that as well. Disenfranchised grief. Before we read into this, do you guys know what disenfranchised grief is? So I guess I'll just tell you. So grief over a loss that's not publicly acknowledged, mourned, or supported. So sometimes this happens with things like unrecognized relationships, so same-sex couples. This can happen, guys. Also things like cohabitation, so you're not married, but you live together for a very long time, all the way to things like the family members of people who have done bad things. Okay. And then they pass away, right? So think about someone who died by, homicide then leading to suicide by a police officer, something like that, right? That could lead to disenfranchised grief by the family. Okay. Also, this could be losses that are perceived as insignificant. So you lose a job, you may have disenfranchised grief. Okay, your pet passes away, or abortion loss. Healthcare workers, we go through this a lot, right? Because we grieve our patients, but they say we shouldn't, right? So then we end up with this disenfranchised grief, right? And that can lead to burnout, right? So I think I've told, maybe not this course or this class, but I knew it was time to go in hospice when I started to not experience that disenfranchised grief anymore, right? So I would walk into a patient's room and I'm just going through the motions of pronouncing someone as deceased. Whereas I used to have those deep, intense feelings associated with it, things like that. Does that make sense to everybody? So it can lead to that sense of burnout. Or you see nurses in the ED where it's just another patient coming through. Okay, that can lead to burnout. Okay, COVID-19 really did a lot of healthcare workers in, okay, so to speak. Okay, because at first we just couldn't handle the volume of loss. Okay, I'll tell you what, I've never had so many hospice patients as I did who were getting taken off the ventilator during COVID. Okay, and they come down to me. So it was a hard time for a lot of healthcare workers. Complicated grief, okay. So this one comes with things like when we're suppressing our emotions or when we're preoccupied on the deceased, so we can't think of anything else, right? Our daily functioning is impaired. And then sometimes comes with those comorbidities along with it. So we start to dive into some psychiatric disorders, Okay, so your patient may develop things like major depression as a result of loss. Nursing considerations. So again, everything's very individualized in how they're going to process this complicated grief. Okay, but we still have to offer that support as needed. So things you might see if someone's going through complicated grief. So we have differences in personality, so low self-esteem, also not trusting in some of the other relationships that these people have. And then previous psychiatric issues may also be something that causes some issues with us when we're trying to care for these patients. Family support is everything when someone's going through grief. So if you lose your only source of family support, it's gonna be difficult, right? That's exactly why my grandma said, hey, I want my whole family to get together when I pass, right? She knew that us getting together to talk about her life would help us, okay? So family support is very important. Okay, but if you don't have that support, or if your support systems are kind of unhelpful, right? You shouldn't feel like that anymore. You should be over this. It complicates our grieving process. Okay. There are different attachment styles as well. We have ambivalent. Has anyone seen the term ambivalent in behavioral health? Did you see that term at all while you were there? Ambivalence is basically at its root those unclear feelings. Okay, so they kind of go back and forth on what they're feeling or thinking, right? It's very unclear. And then dependence, so relying on someone else for their emotional needs. So you might have a patient who all of a sudden is codependent on someone else, okay, for their day-to-day needs. And insecurities. However, just because you are lacking that social support, it doesn't mean you're going to grieve any differently, but there are some risks for that. So how are we going to take care of these patients? Okay, so during that first initial loss or the crisis period, the patient is going to experience that disequilibrium where their life feels like it's in flux, right? How are we going to help them recover? So we have to help them understand their loss, provide them access to help, okay? So that might be us calling the chaplain. It might be trying to show them some counseling services in the area, okay? And then effective coping strategies. I'm telling you what, when my patients would pass away in hospice or wherever I was, I would be like, okay, let's talk about how we're gonna deal with this moving forward. And those family members weren't my patients, right? But I was still trying to care for them. I'd say, okay, so maybe you could do things, that the patient liked to do, right? If they were big readers, you could read, right? Maybe get into some reading or doing things that help you to remember the person, but also work through that grief process. The nursing role, understanding those psychological cues, those behaviors. Again, this is a safety piece for you guys as well. Okay. Like I said, those family members are going to come out swinging with some anger when this happens. We need to be aware of our own safety. Okay. And self-awareness. So making sure you set boundaries, right? Like you guys are not going to go to these funerals or anything like that, right? You need to maintain those boundaries. Okay. And then being attentive. So making sure you have that nice open body language. We're not standing there like this while someone's grieving, like it's taking time out of our day, right? Because I've seen that before. Okay. Or, we've talked about this enough. I'm going to walk away from you now. You have to allow them that time to process. And making sure that they all feel very safe while they're talking about these things as well. Okay. Questions over grief and loss. Only on your final. It's not on this next exam tomorrow, just on your final. And I'm not sure how much Mrs. P, like how many questions or anything like that, but it will be on your final. But hopefully you got something extra out of it today. I know a lot of it we've already seen or experienced ourselves. So hopefully you got a little bit out of it, but definitely look at those stages of grieving. Okay, because that's going to be very important to know. Okay.